Talquetamab is a GPRC5D CD3 bispecific antibody. So GPRC5D is highly expressed on plasma cells, and so it's suggesting it's an attractive target for anti-myeloma therapy. So what I presented at ASH was 2 dosing schedules for this bispecific antibody, a weekly dosing schedule and a biweekly dosing schedule. Both those schedules use step-up dosing to mitigate the risk of cytokine release, and then followed by the weekly or biweekly subcutaneous dosing. And what we saw was that most patients did get cytokine release, 77%, but it was generally quite mild. There was only 1 patient with grade 3 cytokine release. And there were other side effects noted that were relatively unique to this molecule. For example, we saw skin and nail related disorders in about 75% of patients. And GPRC5D is expressed on keratinized tissue, so around the hair follicles and also in the nails. So we did see onychomadesis, which is some lifting of the nail beds, and nail dystrophy in a portion of patients. We saw rash, a grade 1, grade 2 in most patients. A few patients had a grade 3 rash that responded to steroid therapy. In addition, we saw dysgeusia in about 60% of patients. And as expected, the cytokine release in 77% of patients. Cytokine release in all patients, though, was grade 1 and grade 2. There was only 1 patient with grade 3 cytokine release. What we're most excited about is, number one, the infection profile seemed quite good, with a very small proportion of patients having grade 3 or grade 4 infections. It was less than 10%. In addition, the response rates in both dosing schedules seemed very promising. The response rate was between 67 to 70%, and over 50% of the patients had a very good partial response or better. And the median duration of response has not been reached in either of the dosing schedules. So it seems that GPRC5D is a very good target for myeloma therapy. This bispecific antibody also seems a very promising therapy with deep and durable responses.